What is Crestor and how is it used? Crestor is a prescription medicine used to lower LDL cholesterol, low-density lipoprotein, and triglycerides in the blood, slow the progression of plaque in the blood vessels, reduce the risk of stroke and heart attack. Crestor may be used alone or with other medications. Crestor is a lipid-lowering agent, statins, HMG-CoA reductase inhibitors. It is not known if Crestor is safe and effective in children younger than 8 years of age. What are the possible side effects of Crestor? Crestor may cause serious side effects, including unexplained muscle pain, muscle tenderness, muscle weakness, confusion, memory problems, upper stomach pain, tiredness, loss of appetite, dark urine, yellowing of skin or eyes, jaundice. Get medical help right away if you have any of the symptoms listed above. The most common side effects of Crestor include headache, weakness, muscle aches, nausea, stomach pain. Tell the doctor if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of Crestor. For more information, ask your doctor or pharmacist. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Crestor, rosuvastatin calcium, is a synthetic lipid-lowering agent for oral administration. The chemical name for rosuvastatin calcium is bis, E-7-4-4-fluorophenols-6-isopropyl 2-methyl-methylsulfonyl, amino, pyrimidine 5YL, 3R, 5S-3, 5-dihydroxyhept-6-enoic acid, calcium salt with the following structural formula. Crestor, rosuvastatin calcium, structural formula illustration. The empirical formula for rosuvastatin calcium is C22H27FN306S, 2Ca and the molecular weight is 1001.14. Rosuvastatin calcium is a white amorphous powder that is sparingly soluble in water and methanol, and slightly soluble in ethanol. Rosuvastatin calcium is a hydrophilic compound with a partition coefficient octanol/water of 0.13 at pH of 7.0. Crestor tablets for oral administration contain 5, 10, 20, or 40 mg of rosuvastatin and the following inactive ingredients. Each tablet contains microcrystalline cellulose NF, lactose monohydrate NF, tribasic calcium phosphate NF, crospovidone NF, magnesium stearate NF, hypermellose NF, triacetin NF, titanium dioxide USP, yellow ferric oxide, and red ferric oxide NF. Question: what is cholesterol? See answer. Crestor coupons. 3 pharmacies near 35,290 have coupons for Crestor, brand names, Crestor for 5 mg. Hyperlipidemia and mixed dyslipidemia. Crestor is indicated as adjunctive therapy to diet to reduce elevated total C, LDL-C, ApoB, non-HDL-C, and triglycerides and to increase HDL-C in adult patients with primary hyperlipidemia or mixed dyslipidemia. Lipid-altering agents should be used in addition to a diet restricted in saturated fat and cholesterol when response to diet and non-pharmacological interventions alone has been inadequate. Pediatric patients with familial hypercholesterolemia. Crestor is indicated as an adjunct to diet to reduce total C, LDL-C and ApoB levels in children and adolescents 8 to 17 years of age with heterozygous familial hypercholesterolemia if after an adequate trial of diet therapy the following findings are present: LDL-C greater than 190 mg per deciliter, or greater than 160 mg per deciliter along with a positive family history of premature cardiovascular disease, CVD, or 2 or more other CVD risk factors. Reduce LDL-C, total C, non-HDL-C and ApoB in children and adolescents 7 to 17 years of age with homozygous familial hypercholesterolemia, either alone or with other lipid-lowering treatments, example, LDL apheresis. Hypertriglyceridemia. Crestor is indicated as adjunctive therapy to diet for the treatment of adult patients with hypertriglyceridemia. Primary dysbetalipoproteinemia, type 3 hyperlipoproteinemia. Crestor is indicated as an adjunct to diet for the treatment of adult patients with primary dyspeptilipoproteinemia, type 3 hyperlipoproteinemia. Adult patients with homozygous familial hypercholesterolemia. Crestor is indicated as adjunctive therapy to other lipid-lowering treatments, example, LDL apheresis, or alone if such treatments are unavailable to reduce LDL-C, total C, and ApoB in adult patients with homozygous familial hypercholesterolemia. Slowing of the progression of atherosclerosis. Crestor is indicated as adjunctive therapy to diet to slow the progression of atherosclerosis in adult patients as part of a treatment strategy to lower total C and LDL-C to target levels. Primary prevention of cardiovascular disease. In individuals without clinically evident coronary heart disease, but with an increased risk of cardiovascular disease based on age greater than or equal to 50 years old in men and greater than or equal to 60 years old in women, hsCRP greater than or equal to 2 mg per liter, and the presence of at least one additional cardiovascular disease risk factor such as hypertension, low HDL-C, smoking, or a family history of premature coronary heart disease, Crestor is indicated to reduce the risk of stroke, reduce the risk of myocardial infarction, reduce the risk of arterial revascularization procedures. Limitations of use. Crestor has not been studied in Fredrickson type 1 and V dyslipidemias. General dosing information. The dose range for Crestor in adults is 5 to 40 mg orally once daily. The usual starting dose is 10 to 20 mg once daily. The usual starting dose in adult patients with homozygous familial hypercholesterolemia is 20 mg once daily. The maximum Crestor dose of 40 mg should be used only for those patients who have not achieved their LDL-C goal utilizing the 20 mg dose. See warnings and precautions. Crestor can be administered as a single dose at any time of day, with or without food. The tablet should be swallowed whole. When initiating Crestor therapy or switching from another HMG-CoA reductase inhibitor therapy, the appropriate Crestor starting dose should first be utilized, and only then titrated according to the patient's response and individualized goal of therapy. After initiation or upon titration of Crestor, lipid levels should be analyzed within 2 to 4 weeks and the dosage adjusted accordingly. Pediatric dosing. In heterozygous familial hypercholesterolemia, the recommended dose range is 5 to 10 mg orally once daily in patients 8 to less than 10 years of age, and 5 to 20 mg orally once daily in patients 10 to 17 years of age. In homozygous familial hypercholesterolemia, the recommended dose is 20 mg orally once daily in patients 7 to 17 years of age.